Hey everyone, this is Dr. Perry from Stop Chasing Pain. Thank you so much for your interest in tuning in to look a little bit more about blood flow. This is some of the stuff we're going to teach you in our Blood Flow Mojo course, one of our most popular courses that we teach and things that we do to help people that are suffering in chronic pain and chronic inflammation. One of the things that I always say is that nothing is going to heal if you don't have blood flow. And if you have slow blood flow, you have slow healing. If you have no blood flow, you have no healing. If you have optimal blood flow, well, then you have a chance for optimal healing. So we talk about flow pipes. Let's concentrate a little bit on this front view, anatomical view of the body. So this is me looking straight on. This would be the person's right side here. This would be their left side. And I'd like for you to focus on this middle section here that you see in red. You should see this big red pipe coming down from here. And then right around the navel, your belly button, is where that splits off. Okay, it bifurcates where it turns into another artery coming down towards the groin on the right, another one coming down towards the groin on the left. And you can see that it's going to continue its way down into the leg, come down here and dives behind your knee to send all of that blood flow towards your what? Your feet. What I want you to know is that all of these pipes connect. Some pipes are bigger, then they become smaller, then they become really tiny, and they have all these different names. But in my world, the names actually are irrelevant because I just want you to know that whatever you choose to call the pipes, they all connect and they're considered one flow pipe based on pressure. So for instance, this one here is called your abdominal aorta, all right? And that's the big pipe. And when it hits the navel, it splits off into what's called the common iliac on the right, the common iliac on the left. Then when it hits the groin, it becomes the femoral artery on the right, and then it becomes a femoral artery on the left. And you're like, that's great, but how in the world does that help me knowing that? It doesn't, because it's the same pipe. It's just bigger and it comes smaller. Now, when things flow, sometimes they can get stuck and stuff doesn't flow well. One of the biggest places that things get stuck, I'm going to teach you something that could change your life. It's also part of our Navel Mojo, belly button Mojo course, is to pay attention to your navel. And most people never do because the navel doesn't hurt. They say, Doc, I got to come see you today. My navel is on fire. It's killing me. No, it's usually somewhere else that's hurting them. That's just where they feel the pain, but it can be coming from the navel because when I stick my finger around the navel, then they know it hurts. And the point is, it's not supposed to hurt around the navel. If it hurts around the navel, automatically you need to assume there's something going on underneath it with the fascia and the connective tissue or the vascular flow with the arteries and the veins and the lymph because they always travel together. So where the navel is right here, all that tension in there is a sticking point, and it can block or compromise or make the flow less efficient down one side than the other side. So that's the person who may have tension in the navel and they get more blood flow down the right side and they get less blood flow down the left side, and then they feel pain on the left side because it's not getting enough blood flow. And then that's the person who treats the left side. Let's say, for instance, my left knee hurts and I keep treating my left knee and it's not getting any better. Then I'm going to ask you, where does the blood flow to your left knee come from? And then that's when you point up here at the navel and down this pathway. So what we teach you to do is work the navel, massage the navel, dig into the navel, put vibration on the navel to help anything down in the lower part of the body. And now that you know that, if you did the navel, Where does the navel continue to? It goes down into the crease of the groin. So then what you can do is you can work around the crease of the groin with the same techniques. You can massage, you can do vibration, and you always want to do both sides so you can even out the flow. I just want you to understand the flow routes of what's there. And during the class, we're also going to teach you a different technique. I'll give you a little bit of a heads up on this one. It's really, really cool. So when stuff flows down this pipe, fluids got to go down to your right side, fluids go down to your left side, right? But what I can do is I can put pressure on a pipe and I can block a pipe and push flow somewhere else. So let's say for a scenario that we teach you in the class, we go back to what I said before is that there's good blood flow down the right, but there's less blood flow down the left. So how can I get more blood flow to the left side? One, I could work the left side and reduce tension on the left side that may be causing the reduction of blood flow on the left side. That makes sense? So you would use your vibration ball and your massage around the navel. Then you would do the same thing around the crease of the groin. And you also hit your lymphatic nodes there. So you have most of your lymph in your abdomen. And it always gets stuck around the navel. So make sure you see our Big 6 lymphatic Mojo reset that I'll put. It's just on my website. It's kind of everywhere because the Big 6 is so phenomenal in helping everybody. So make sure you do that. And when you do the Big 6, you automatically improve blood flow. Check the win box there. All right. So let's get back to this though. So I could release the left side, but I could also send more blood flow to the left. How can I do that? Well, I'm going to show you. I'm going to choose a different color. I'm going to choose like light blue. What I can do at this standpoint is that I can actually put pressure on the right side with my hands, and I can block that blood flow from going down the right leg, and I'll put pressure on it. And when I put pressure on it, the flow can't go down the leg because I got pressure on it. And so where does the flow go? It goes back up here, and then more flow goes to the left. So I divert blood flow to the left-hand side, which pushes through on the left side, gives more blood flow there, and washes out anything that may be there, like some toxins, stuck stuff, thickened blood in that region, what happens when you have poor blood flow and function of your spleen and your lymphatics. And then I can help this side. So that's a person who comes on in and they say, Doc, I've got chronic pain in my left hip and my left knee. It's not getting better. Then from a blood flow mojo standpoint, I will increase blood flow to those areas by blocking blood flow on the right for a temporary bit with my hands to send blood flow over there and flush it out, okay? Which is very different than just treating the knee and the hip. So you would treat the navel, the knee, and the hip, block the blood flow on the right, to power wash, I call it, the ones on the left. And then that's the person who says, holy cow, doc, it feels a little bit better. All right. That's the kind of stuff that's going to be coming your way in our Blood Flow Mojo course, which is this. We say, know your flow. If there's a part on your body that hurts, let's say your right foot, you need to understand where the blood flow comes from here to get to your right foot. Hint, 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 it's at the navel. And then where does the blood flow from the foot have to go? It's got to go back up and out the same way, and that's through veins. Okay? And then the veins ultimately end up bringing stuff back to where? Right? Up to your heart. So then it can flush back stuff out again and go through the whole cycle. All right? We teach you the routes. We teach you how to open them up. We teach you how to optimize flow because, as I said in the beginning, optimal flow, optimal healing. Slow flow, slow healing. No flow, no healing. No flow means stuff's going to die. Necrosis, right? And that's not good. Awesome. Thank you, everybody, for tuning in a little bit to the video. Hope you get super excited on learning how to change fluid flow dynamics in the body, because when you do that, trust me, I promise you, you're going to make a huge difference in your recovery, your healing, your regeneration, and you'll be able to live the life that you want to live and go hashtag beast mode monster. We'll see you at Blood Flow Mojo and Navel Mojo. Registration links are underneath the video here in the description. You can go to our website and sign up as well and check out all of our other videos. Dr. Perry from Stop Chasing Pain, thank you so much. We'll see you.